All right, the next couple videos are kind of challenging, and they're challenging in a different way than what we've been doing in the past. It's not that there's a lot of math, a lot of calculations that need to be done. Rather, it's just the terminology that's kind of weird. And sometimes when I'm teaching this stuff, I kind of feel like I'm talking in circles. I explain one term, but then it opens up the door for another term that we have to explain. So what I'm going to do here, which is a little bit different than something we've done so far, is I'm going to go through all of the terms that we have for this material that you need to begin these lectures. Okay, we'll add a couple of terms as we go through the material, but you sort of need these to talk about health insurance at all. So I'm just going to go through all these definitions, and I'm also including these definitions on your worksheet. So as you're going through the questions and everything for the quiz, definitely refer back to this to help you remember these terms. You kind of have to just sort of memorize these terms to understand what they mean, or health insurance will just be so complicated. So in no particular order here, I'm just going to go through each of these ideas. A health insurance premium is your mandatory health insurance fee. And this is usually monthly. Okay, so if you get a job and you get health insurance through your job, which most of you will do, your health insurance premiums will be automatically deducted from your paycheck. And remember that when you have health insurance premiums, it reduces all of your taxes. So $100 in health insurance premiums will reduce your taxable income by $100 for income taxes, Medicare, and Social Security. So this is your payments. Even if you don't have any actual medical expenses, you don't go to the doctor or anything, you will end up paying this every single month. Okay, so that's your premiums. All right. In the cases of these, I've given examples for my own situation in terms of what my own expenses are. So just in case you're curious, I pay $280 a month for my health insurance premiums, and so $280 is deducted out of my paychecks every single month. It's outside of my control. These definitions on here are lengthier. I'm just going to try to be quick with these. In-network means that your health expense is taken care of at a place that is connected to the health insurance company. Okay, health insurance companies will create contracts with particular medical providers, and then they'll negotiate on prices of different things. So for example, let's say that you have an appendicitis and you have to have your appendix taken out. They will go ahead and agree on what the price of an appendix removal should be. And assuming you don't have any complications, that is what the insurer will be charged. That's if it's in network, okay? If it's out of network, they're not connected to that medical to that medical care provider at all. So in network just essentially means that the health insurer prefers you use these providers. Okay, so usually you're incentivized to go with these in-network providers. So you might have two hospitals in your city, and one is in-network and the other one is out of network. You should go to the in-network one if you're trying to reduce costs, because usually you're incentivized to do so. So you definitely, this is one of the more important things, because it's kind of one of those things you can control, right? You can't really control your premiums, that's just what you're going to pay. But you can make sure you're going in-network whenever possible. So this is usually going to be more expensive for you. All right, so again, the whole idea here is your health insurance provider has contracts with some medical providers. They're going to give you a better deal there. They don't have contracts with other providers, so they disincentivize you to go there, okay? So that's in-network versus out-of-network. All right, out-of-pocket. Out-of-pocket basically just means these are expenses you pay. And you may be surprised to find out that with most health insurance plans, you're paying 100% of the expenses that you have. All right, so if you go to the doctor and you have an $800 expense, it's likely that your health insurance provider will cover none of that. We'll explain why when we get into the later videos. But essentially, out of pocket just means you pay out of pocket. It comes out of your expense, okay? These terms we're going through right now are kind of related. Deductible is the kind of like a spending threshold where your health insurer begins paying for stuff. So it will no longer be fully out of pocket for you when you have an expense, okay? Deductible is a big deal in health insurance, and we're going to talk more about how this looks in a bit. But I'll go ahead and give you my amount here. My health insurance deductible is $4,400. And what that means is up until I hit $4,400, I pay for my expenses entirely. All right, so the first $4,400 in expenses that I have, health care expenses that I have, I pay for completely, okay? So this is how it works. I pay my premiums, all right? Nothing I can do about that. And then I start fresh. I basically have $0 in medical expenses. Up until I hit $4,400 in medical expenses, I pay for everything. Everything will be out of pocket, okay? Then, once I hit my deductible, my health insurance company will start paying at least a share of my expenses, all right? And if I continue to have healthcare expenses, maybe I have, a really rough year where I have a lot of injuries and such, well, then I might hit my out-of-pocket maximum. And this is the spending threshold where my health insurer pays for everything. And for me, that amount is $7,400 if I stay in network. If I go out of network, it's actually twice as high. And you can see why you'd want to stay in network. All right, so there's kind of three categories that I could be in regards to my healthcare expenditures. I could be in a scenario where I haven't met my deductible. All right, if I haven't met my deductible, I pay 100% for my expenses. Once I hit my deductible, I'm going to be paying 20% for my expenses. All right, that is just specific to my plan, but there's a good chance yours will be exactly the same. So I pay 20% after I've hit my deductible. And then if I get to the point where I've spent $7,400, I will have hit my out-of-pocket maximum, and I will spend no money after that, okay? So it's important that we understand each of these categories because you can use that information. So for example, I'm going to tell you guys some news here. I'm thinking about getting a vasectomy. I've already got 2 kids, okay? But I'd be smart to do it in a year where I already have met my deductible. It will reduce my cost for that expense, okay? I use a vasectomy because that's something I can choose when I'm going to do it, right? I don't have to do it at any given moment. If you have an appendicitis, that's different, right? You're not going to be like, oh, I'm not going to the doctor. I'm going to wait until next year. That's ridiculous. But there are some medical expenses you can choose when you have them, and so you'd want to think about what expenses you have so far, okay? You can see in regards to how expensive this could be, it's kind of like if I stay in network, the most I could possibly spend on my health insurance for an entire year is the amount that I spend on my premiums plus my out-of-pocket maximum. So for a lot of people like me, the most I can spend in a year is, close to $10,000 for all of my medical expenses, all right? And that's true as long as I stay in network and I do covered medical expenses. If I decide I'm going to get a nose job or something, well, that's different. That's not going to be covered most of the time, right? So it's got to be covered expenses, which is, going to be the stuff that you typically expect. Okay, so I'm going to erase this. Continuing on with my terms. Just trying to give us the tools that we need to discuss this in greater detail. So a copay. This is something that we're going to see more in the comprehensive medical systems. The comprehensive ones are ones that usually have high premiums, but cover more of the things that you're going to be paying for. So copay basically is like a flat fee for standard medical expenses that you pay and the insurer pays the rest. Typical amount for this is like $20 or $30. I know I've seen 20 a lot. So, for example, it might be $20 for a doctor's visit. You know, kind of like a standard doctor's visit, like maybe you have a sinus infection or something and you want to go see if you need antibiotics. You're going to pay $20 to go to the doctor that day. And your insurer is going to cover the rest, right? Which will probably be much more than $20. You know, maybe the expense is $300 total. You just pay $20, which almost sounds like so small. Why even charge you anything? Well, the logic here is if there was no copay, if it was just free for you to go to the doctor, people might go to the doctor a lot, right? If it's free to go. So this is kind of giving you some skin in the game. You don't want to just go to the doctor all the time because then you're going to be charged these $20 fees over and over again. So it's trying to disincentivize you from going when you don't really need to go. So that's a copay. You should know what that is. If your doctor says, oh, it's just a $20 copay, that's just your fee for a pretty standard medical experience, like just going to the doctor, right? Open enrollment, okay? Kind of shifting gears here a little bit. Open enrollment refers to a time period, usually about 45 days. A lot of times for government work and a lot of other major health insurance providers stick to the same guideline that they use for the federal government. It's 45 days. That's kind of a standard procedure. So this is a time period in which you can change your health insurance plan. So you might decide you want to switch from what you're going to learn as a high deductible plan to something maybe like a comprehensive plan. Well, that's a big change, okay? And you only have this one window to do it. In fact, there's typically only 3 times where you can change your health insurance situation. 1, you get a new job, all right? You're getting a new job, you'll get the chance to decide what health insurance plan you want because it's usually tied to your employer. 2, you have what's called a qualifying life event, a major life change. For example, you have a kid being the most common, or maybe you get divorced. And then the 3rd is this open enrollment period, all right? And this is the one that's going to be most important because this is the one that's going to come up over and over again in your life. So the open enrollment period is the time where you can make changes to your health insurance plan. And I find that I make changes most years, okay? There's lots of things that you might decide to do. You might decide, for example, I mentioned a real world example for me. One year I knew I was going to need dental surgery. I had a crack in a tooth. I knew it was going to be expensive to get it fixed. It wasn't like something I needed to do right away. So I waited until open enrollment. I elected for dental insurance, which was like $10 a month, all right? And then once my dental insurance kicked in, I got the surgery. Next year, cancel my dental insurance plan, all right? So there's various reasons why you might want to adjust things in your health insurance plan. So the open enrollment period is going to be a time that you really want to pay attention to that, okay? And that's all I'm going to talk about for now. I think once we have these ideas available to us, we'll be able to discuss the 3 types of health insurance plans that are most common. And remember, when it comes to health insurance, you know, you definitely want medical coverage. You want to be safe. You want to be healthy. But it still really boils down to a dollars and cents game. So let's try not to be emotional here. A lot of people think they just need the best health care provided. They just need the absolute best health insurance. But that's not usually a very reasonable way to think about things. If you're healthy, you probably don't need significant health insurance. So we want to make sure that we are minding our dollars and cents. After all, this is a personal finance class. All right. We're now going to talk about the 3 types of health insurance plans, and we're going to spend a lot of time on this first one because it's probably the plan you're going to use. It's called a high deductible plan, okay? Hopefully you'll recall from the last video, your deductible is how much you have to spend out of pocket before your health insurance provider pays for really anything, okay? And so a high deductible plan, just like it sounds, has a high deductible. It takes quite a bit of spending before your insurer starts to make spending, okay? So for a high deductible plan, what's typical about this is you get a high deductible, of course, which is bad, but low premiums, which is good. So in terms of your guaranteed spending, how much you're going to have to pay for premiums, it's going to be low. So this is often thought of as being like the best plan for people that are healthy, and it usually is. So if you know you're unlikely to have a lot of health spending because you know you're pretty healthy, you're young, then this probably is going to be the plan for you. Even for people who are not healthy, even for people who have a lot of medical expenses, it actually turns out that this plan is best for a lot of people. One reason this plan is so good is it's the only plan that offers an HSA. We've talked in the past about how great a health savings account is. So if you want an HSA and you want all that great tax savings that the HSA provides, you have to use a high deductible plan. So for a lot of people, the high deductible plan is going to be the best choice. Perhaps everyone watching this video right now, at least for their first job, is going to take a high deductible plan, okay? In regards to the amount that you're going to have to pay in terms of premiums, these expenses are usually going to be broken into 3 possibilities. And this is exactly the case for me. I have 3 options in terms of my health insurance. I can be just counted as a single. Even if I am married and have kids, I can just have my own health insurance separate from anyone else. I could have me plus a spouse, or I could have a family plan. All right, that's the 3 options that I have. And if I go with the individual plan, my premiums, of course, are going to be the smallest. So it's going to be $982 a year here at Georgia College with the high deductible plan. And of course, this is going to be quoted monthly, all right? So take that divided by 12, that's how much your monthly payments would be. If I go me plus a spouse, you might be tempted to think that your expenses would just double, but it's actually much more than a double. The logic here is that basically they really don't want to cover you. They prefer not to cover you. And if you decide you want to cover you and your spouse, you may be doing it because your spouse has a lot of medical problems. So they're going to make it much more expensive to cover you and your spouse. All right, so that's often not such a great deal. For that reason, if you and your spouse both work, there's a good chance you'll each be on your own separate health insurance plan. That's the incentive that's being created by such high premiums. And then the family plan is often kind of a steal in terms of the price, $3,360. What's kind of unique about this is you'll recognize with the family plan, it becomes a better and better deal the more people you have in your family. This family plan will basically cover you, your spouse, and any of your dependents, okay? Maybe not all dependents, but certainly your kids. I don't know if it would cover your grandparents, for example, if you were taking care of them. So $3,360, that's not a bad deal. And this is probably worth mentioning here, that as you add people to your plan, think about how the costs change. So if I go from no plan to having just me covered, just a single plan, I would go from paying nothing, of course, to $982, all right? So that would be my change in cost. If I add a spouse, the cost will go up by $1,447. That's just the difference between these two, okay? So continuing to add people to this plan, I now add a kid. So me, a spouse, and a kid. That's going to add a cost of $931. All right, so that's the difference between these two values here. And I'm pointing this out just because recognize that as you add anyone else to this plan, as you continue to add kids to the plan, they're not any more expensive. So if you were to have, for example, 10 kids, those 9 kids that you just added to that plan add nothing to your health insurance premiums. There's 2 kind of interesting things to recognize about this. One, this makes it relatively cheap to have more kids because your health insurance premiums don't go up usually at all as you add more kids. And 2, if you're wondering why your health insurance premiums are high, part of that is because you're effectively subsidizing those that have big families. Big families are kind of a drain on the system in terms of how it's set up right now. So you are essentially paying more than your fair share because some people like me with 2 kids are paying really less of my fair share. So if you're thinking about health insurance as a deterrent of having more kids, it really isn't. In regards to the high deductible plan, you can kind of categorize spending into 3 groups. We won't spend too much time talking about this, so I definitely want to make sure I make note of it now. In regards to medical expenses that you could have, you can think about lots of things you could pay money for. Some are going to be categorized differently. So as I mentioned before, what if I decide I want to have a nose job and it's just because it's for my own vanity, right? In that case, that would be not covered. So things like that are non-covered expenses. Things that you're choosing to do on your own accord. They're not recommended by medical professionals, are not covered at all. So there are some medical expenses that you would have to pay for entirely where health insurance doesn't do you any good. So if there's something that you're not sure about, you would definitely want to look into it and see if it's covered or not, okay? Another possibility is some expenses are actually fully covered and thus free for you, okay? These are generally preventative expenses. For example, a lot of times flu shots are fully covered under health insurance plans. Flu shots, immunizations, your yearly checkup, those are usually just covered for free. The logic is if you go to your yearly checkup every year, it's probably going to reduce your overall medical expenses because you'll stay healthier over time, so you're less likely to have some sort of huge disaster. So the health insurance company is basically saying, look, we'll pay for you to get your immunization, right? We'll pay for you to get your flu shot. We'll pay for you to go to your yearly checkup because they're expecting it to save them money in the long run, all right? So there are some expenses that get categorized differently, all right? The third one that we're going to spend the most amount of time on is covered but not free. I don't really know how to name these. They don't really have names, okay? But this third category is covered but not free. These are things that your health insurance provider does indeed cover, but they're not going to pay for. So for example, you break your leg and you need to have surgery, that will be a covered expense. And whether or not you pay for it depends on where you are in terms of your spending the rest of the year. Depends on whether or not you've hit your deductible or your out-of-pocket maximum, okay? So again, there's non-covered expenses, irrelevant in regards to health insurance. They don't help at all. There's fully covered expenses, a few things here. Maybe you get your yearly checkup every year. Your insurer will just pay for that completely. And then most expenses are going to fall into this category here where they're covered, but they're not free. So you might have to pay all of it or none of it or some percentage in between depending on where you are in regards to the deductible and the out-of-pocket maximum, okay? And that's where things get a little bit messy. So I'm going to show you guys my plan just because my plan is so similar to typical high deductible plans. So, you know, if you're thinking, why do I keep showing stuff for myself? Well, I'm on a really typical plan. So yours is going to look quite similar. You're probably single, you probably don't have kids, so yours will just be a cheaper version of what I'm going to discuss here. There's basically, in regards to, so let's focus on the covered but not free. This is where most of the action is, right? The stuff that they pay for is not going to be a lot of money anyway, so it's not really all that important. These are the things you're really going to want to think about when you're making your financial plan. The stuff that's covered but not free, okay? So this is, you know, going to the doctor because you think you might have a sinus infection, you know, this is going to the doctor to, you know, get x-rays, get an MRI, whatever. It's, you know, the typical stuff that you might have to spend money on, aside from preventative measures like yearly checkups. So in regards to these types of expenses, there's 3 possibilities in regards to how you'll be charged. All right, so we're just thinking about the monetary side now of what you'll be charged. You could be in a scenario where 1, your deductible is not met. All right, remember the deductible is the threshold that you have to meet in terms of your spending, in terms of your out-of-pocket spending before your insurer does any spending, okay? So if you have not met your deductible, you're going to pay 100% of your out-of-pocket costs, or in other words, the expense will be fully out of pocket. So if your deductible is not met, you will pay 100% of any medical cost. Okay? So that would be the amount up to your deductible. For me, my deductible is $4,400. So if I've spent no money on medical expenses and I suddenly have a $1,000 expense, I will pay for it entirely. A lot of times people are surprised by that. They tend to think that health insurance is covered by their health insurer, right? And it's going to pay for their medical expenses. No, a lot of your expenses are not going to be covered at all by your health insurance company. Okay, so up until I've spent $4,400, I'm going to pay fully for any expenses. And actually, I'm 34 years old. I've had health insurance, through my employer for like 8 years. There's only been 1 year where I've hit my deductible, which is good because we've been healthy. But you can think of it this way. My health insurance company has basically done nothing for me for the most part. I'm paying these premiums every month, and the only thing I'm getting for free is my yearly checkups and flu shots, right? So until you've hit your deductible, you pay for your expenses entirely. The second sort of situation you can be in is your deductible is met, but you haven't hit your out-of-pocket maximum. This is kind of that little purgatory between you're paying for it all and your insurer's paying for it all. Your insurer is going to cover a percentage of your expenses, okay? And for me, my insurer covers 80%, and I have to pay 20% in this category of spending. So up until I have spent $7,400, that's my out-of-pocket maximum. The area sort of between those two amounts, I'm going to pay 20% of my expenses, all right? So if so far I've already spent $5,000, right? If I've spent $5,000 already, $4,400 I would have paid for entirely, and then the remaining spending I've done, I've only contributed 20% to the expenses, okay? So once you hit your deductible, your health insurance kicks in and usually pays for the majority of your expenses, all right? The third possibility is you've hit your out-of-pocket max. And once you've hit your out-of-pocket max, your employer, or rather your insurer, is going to pay fully for your expenses. All right, so that's the three potential categories of spending there. Again, your deductible has not been met, you pay for all of it. Your deductible is met, but you haven't hit your out-of-pocket maximum. That rate is often 20%, so you're going to pay 20% of your expense. And then once you've hit your out-of-pocket maximum, your insurer is going to pay for everything. So where you are on this little table is going to kind of decide perhaps what sort of expenses you're willing to take on. A lot of times medical expenses are elective in a sense. You can choose whether or not to go through medical expenses. So where you are might determine what you should do. If you have not hit your deductible at all yet, that means medical expenses will feel expensive to you. If you've hit your out-of-pocket maximum, well, now additional medical expenses are essentially free. So you might think about choosing when to do, elective surgeries and such. All right, so this is a question that you'll see, a very similar question to what you'll see on the quiz for this material. It's a math-based question, and it's really easy to make one common mistake, and so I wanted to run through this to help you avoid that mistake. So this is using my actual information, which recall that the type of health insurance system I'm on is very similar to probably what you'll have, so it seems reasonable to use my actual figures. So I pay premiums of $280 a month. My deductible is $4,400, and once I hit my deductible, I pay 20% of medical costs until I reach my out-of-pocket maximum. So given that information, what I'm asking for in this question is, ignoring premiums, how much will I have to pay out of pocket if I have $10,000 in medical expenses? Definitely a useful exercise because you might want to plan this out. You know, you're trying to figure out how much money you need to save. You're trying to figure out how much money to put into your 401k or your HSA. And in order to figure that out, you need to figure out what your medical burden might look like. Or maybe you're about to have a kid and it's going to cost $7 grand. You try to figure out how much that would actually cost you. That's a really useful thing to think about. So what I recommend for a question like this is, given this information, I would start building a little table. All right, and that's what I've already began working on here. I'm going to put the out-of-pocket spending that I do, and then the burden that I face at each spending level. There's essentially three states of spending here. There's the pre-deductible state, the deductible state where I've reached my deductible but not my out-of-pocket maximum, and then the period where I've hit my out-of-pocket maximum. And in those three cases, I face a different burden. I pay a different share of the overall expenses. So for the first $4,400, mistake here, this should be $7,400. There we go. So for my first $4,400, that's my pre-deductible state. I pay 100% of any medical expense that I have, right? Up until $4,400 is hit, I pay for all of my expenses. My insurance doesn't cover anything, okay? At $4,400, I hit my deductible, and that changes things. After my deductible is hit, I now face this little realm where I have hit my deductible but not my out-of-pocket maximum, and I'm going to pay 20% of my expenses in that within that category. And then, of course, lastly, once I hit $7,400, I'm not going to pay anything. And so all systems are not exactly the same, but the 100% here and the 0% is almost always set up that way. The middle one here is not always 20%. So it's usually this middle category that I'm going to change up on the quizzes. And of course, these brackets could be different depending on where you work, if you're single, married, whatever, okay? So let me show you the wrong way to do this, because I want you to see the mistake and understand why it's wrong so that you avoid it. A very common way to answer a question like this is to set it up in the following fashion. So somebody will set this up, they'll say they're out-of-pocket expenses, they've got $10,000 in expenses here, so for the first $4,400, they're going to pay 100%, all right? So they're going to definitely spend $4,400 right up front. Then, for their next $3,000, this batch in here, they're going to pay 20%. And then essentially, if you set it up this way, you would be tempted to think, well, then that's it. You don't have to pay anything else. And so this would be a way to solve for it. Unfortunately, this is the wrong way, and the answer you get is going to be incorrect. Let's just for the heck of it, let's see what this comes out to. So I believe this comes out to $5,000 in expenses. Okay, what's wrong about this is, think about it this way. This bracket right here represents how much you spend. This is a subtle difference, and you got to understand the difference here, okay? These amounts show how much you are spending out of pocket. So you, as a spender, will not reach the 0% level here. You will not reach your out-of-pocket maximum until you have paid $7,400, all right? So for this person here, you've really just set this up wrong. If you're only paying 20% of this bracket here, then you cannot apply that as the amount that you're going to spend. In other words, how could the answer be $5,000 and you're arguing in this formula, you've solved it as if some of your money is completely being paid for by your health insurer? How could that be the case if you've only spent $5,000? If you've only spent $5,000, you should still be burdened by any expenses that you have, okay? This is where you have to be very careful. So this is totally wrong. Do not make that mistake on the exam. So this is what I recommend that you do to make things easy for yourself. Don't just make that little table there. Have that column, but let's add in another column here. you need to figure out how much medical expenses falls into each of these categories. And I think when I go through this, it's going to make sense if it's not already. All right, so for the first $4,400, you see, for the first $4,400, you will still, of course, face that 100% burden. All right, for your first $4,400, you will pay 100% of the expenses. Okay, but for the next $3,000 here, what you should recognize about the next $3,000 is it will take more than $3,000 in expenses for you to spend $3,000. Okay, remember, you're only covering 20% of the medical expenses. So for you to spend $3,000, you must have incurred $15,000 in additional expenses. Okay, the logic for that is if I take $15,000 and multiply it times 0.2, I get $3,000. So that $3,000 there can only be fully realized if you had $15,000 in medical expenses. If you had $15,000 in medical expenses, see, the insurer would pay $12,000 and you would pay $3,000, and at that point you would have reached your maximum here. Okay, so the medical expenses I need, all right, the medical expenses I need in this post-deductible, pre-out-of-pocket maximum state here is that right there, okay? This $15,000 difference is what would cause me to spend up to $3,000 in out-of-pocket spending, okay? In order for me to hit my out-of-pocket maximum then, I would need to spend $19,400 on purchases. Now, I'm not going to personally pay all of those expenses, but to hit the out-of-pocket maximum, I would need to have $19,400 in medical expenses. You can imagine this is a very, very common mistake that people make. And I think the very first time that I saw this, I made a mistake too when I was thinking about it. In a given year, I had seen that I had $8,000 in medical expenses. And when I saw that I had $8,000 in medical expenses, I thought to myself, wow, I've already hit my out-of-pocket maximum. But your out-of-pocket maximum is not based on how much medical expense you have. It's based on how much you have spent. So until you've spent $7,400, you are still going to be on the hook to pay. Once you hit the $19,400 medical expense amount, then you've reached your out-of-pocket maximum. So to actually figure out what you need to do, you need to determine it yourself. You need to solve for it yourself. And from my experience, these health insurers will try to show you stuff to give you an idea of where you stand, but they're not going to make this part very clear. All right, when you go sign up for health insurance at your HR department, you're going to have to do these calculations yourself if you really want to guide your own experience. Okay, so these burdens still fit in the same. This is still 20%. This is still 0%. And so now we can answer this question in what I think is a more simple way. All right. The tax burden, or rather the out-of-pocket burden that I face here, is going to be equal to $4,400, right, times 1, if you want to think about it that way. 100% of that I'm going to pay, plus $10,000 minus $4,400 times 0.2. All right. In other words, for this $5,600 of medical expenses, I pay 20% of that. All right. Building this little column here helps me see how I need to handle everything in this question. And you don't have to build it like this if you don't want to, but I like to do that because it makes it easier for me to see what's going on. All right. And if I set this up correctly, I'll see what this comes out to. Looks like this comes out to $5,520. And you can see the logic to why we haven't reached the out-of-pocket maximum now. At this point, I've only spent $5,520, so I still am going to be paying that out of pocket, right? I still haven't hit my out-of-pocket maximum. So this is a good way to solve for it. Let me change things up here just a bit. Let's change this to 100,000 a year with extreme medical expenses. Okay, so maybe in this year you get cancer or something. So you've got significant medical expenses. So how much do you think this person would pay in out-of-pocket expenses? Well, I can give you the answer without really doing much math. If their medical expenses exceed $19,400, well, then they'll hit their out-of-pocket maximum. So there's no math really to do if I understand what I'm trying to solve for. They will hit the max of $7,400 in spending. Okay, that's what's nice about health insurance. Remember, we talked about, in the first video, that insurance is really about avoiding risk. Specifically, it's about making the worst case scenario not so bad. And that's what this does here. All right, in the absolute worst case scenario, I only would face $7,400 in out-of-pocket spending. Okay, so given that insurance itself is expensive and premiums are expensive and everything, I'm okay with having potentially to pay $7,400 because I know that what I'm really trying to guard against is those scenarios where there's a catastrophe. All right, if I have an absolute catastrophe, I need something to protect me, and my high deductible plan does a really good job of doing that. And on top of my high deductible plan protecting me from catastrophes, it has low premiums, which I like, and also it's the only plan that gives me my HSA. We all know what an HSA is. We know it's a great deal. So if I want my HSA, I want low premiums, and I want to be protected from catastrophes, high deductible plan is going to be a good call for a lot of people.